Thank you. It's a great pleasure to be part of this conference. I think it's the first conference that I'm attending virtually, so we learn new things all the time. And the COVID world has brought new realities. And so I was invited to speak to this conference. And the brief was that we should talk about our experiences. And I have to confess first that my claim to fame or my invitation perhaps came out of a conversation with Mandu via Twitter. I do it a lot. And it was about a piece he was doing about what is going on with regards to the COVID response in different countries and in different parts of the world. And in my Twitter exchange, I said, African countries are doing a great job with regards to their response and all the doomsday predictions about how COVID would overrun Africa not materializing. But who is learning from us? That was the question I posed. And actually this quote ended up in his, in his piece that he did for Forbes magazine. So as I was thinking about what to talk about today, and I was reading more about the Decolonizing Global Health movement and what's going on, but also broadly about the decolonization as a concept. I asked myself, what did I sign up for? Because this is completely something that is out of my depth. But at the same time, I felt like, okay, as an African institution, perhaps we have something to say about this conversation. And so what I've prepared is a presentation really about what I would call a case study about the African Population and Health Research Center and how we've managed to navigate the power dynamics within global health. And some of the things we've done that perhaps, if you look at the framing that I've decided to pick, constantly chipping away is how rocks become sand. And within that saying, I think that there's several things to take away. One is that consistency somehow implies that there's some kind of intentionality or not, but that actually there's some kind of long-term persistence about doing something. Chipping away seems to imply that there's a peripheral role that as an African institution we've played in this conversation or in this movement. And that if you look at the whole saying that maybe doing things without intending to achieve a specific objective, that somehow, I don't know who it is that chips away at the rock, but that whoever does the chipping perhaps did not intend to form sand, but in the end sand was formed, and that sand is a good thing. So this is the frame that I chose to approach this, my presentation, because as an institution, we didn't set out to decolonize global health, but somehow there are parallels in how we've been able to achieve our institution objectives, how we are on our pathway to achieving our vision as we see it, and how perhaps there are parallels that the Decolonizing Global Health movement can learn from our experience. So the key messages that I have, I hope that at the end of it all, that it will be clear that the Decolonizing Global Health movement needs to broaden its reach. I think this has been said by several other speakers, not just geographically, but in terms of the actors it brings on board. I've seen about leaning in and leaning out and other terminologies that are being used, but that's also the movement should have long-term objectives and intentionally, and I think the key word in this is intentionally, work towards them. Because success does not happen because we want it to. It's because we actually persistently work towards that success. So what I'm going to present, as I said, is a case study on the African Population and Health Research Center that is on something that is completely different, but that has lots of parallels that can be drawn with regards to challenging power dynamics, with regards to challenging our own biases and our own power, with regards to consistency, with regards to defining yourself, to having a vision and working towards it. So for those that may not be familiar with APHRC or the African Population and Health Research Center, we are an African-led organization headquartered in Nairobi. And as one would expect, we navigate constantly the power dynamics in global health, whether it's with regards to funding, whether it's regards with partnership, whether it's regards with even having a voice at the platforms and in the forums and in the places where African voices need to be heard. And it's about an institution that has defined a niche itself and has found our voice in places that matter and not necessarily the places that have been defined as being important, and challenging the status quo and our own power constantly, not just in words, but in the actions that we take. So, and as I've said, as I was going through the case study, my conclusion was that we seem to have chipped away at the rock, but unintentionally. And hopefully that's a good thing. So the context, of course, is that there's a lot happening with regards to global health, decolonizing global health movement. Some of it has been there for quite some time. Perhaps the intent was not to decolonize global health, but it's also implicit when you see some of the objectives of initiatives, for instance, that have been designed by the Council on Health Research for Development. That is my first encounter with concepts about equitable partnerships. And as decolonizing may not have been the intent, but I think it's something that's been going for quite some time. And then, of course, more recently, the decolonizing global health movements that have been presented by the previous speaker. There are funders initiatives that are looking at equitable partnerships, trying to develop metrics to measure equitable partnerships within grant applications. So my conclusion is that African institutions are beneficiaries. Sometimes they're participants, but most times they're spectators. So things happen, and somehow we benefit, and sometimes we don't even know we've benefited. And that's when going back to my first point, that in terms of broadening the actors into this, that the voices of African institutions and institutions from other parts of the world need to be heard more about how they could be participants in shaping the agenda, the objectives, the strategies, not just to be beneficiaries and spectators of good things like forming sand out of rocks. So as an African institution, A is for African, Africa-based, African-led. It's a quite circumstance to be in. We are not for profit, so we are not government. And so we navigate different challenges with regards to how we relate with governments, how we relate with civil society. But our aim is that African voices that participate in discourses that affect Africans. And those African voices, that they need to be informed so that they're not participating based on whims, but that they're actually informed. And when you talk about discourse that affect Africans, that this ranges from discourse in a church, for instance, or any other religious place. It ranges to a discussion around how to run a hospital, how to run a subnational unit of governance, whether it is a county or whether it is a district. Yes, so one of the things that is important as we examine ourselves and our own way of working is that it goes back to the point I made earlier, that what you want does not necessarily happen. You have to set in place systems and structures. And so as an institution, if you wanted really to have researchers and scientists that buy into the ethos of doing research for the wider benefit of society, then the culture of research that we put in place, the systems and the structures that not just give significance to research and research productivity, but they give to evidence uptake behavior were important. And I think the lesson to that, you can press next. The lesson to that is that as a decolonizing global health movement, that what it is that you want, whatever vision that you want, there have to be systems and structures. And I think I saw that in Renzo's presentation towards the end. There have to be systems and structures that give significance to the desired behavior that you want to see. And that somehow there needs to be some kind of process that actualizes some of the visions and wishes that we have. Next slide, please. Yes, so part of our culture up there, you can also press next. There's a small thing at the bottom. Previous slide. Our vision is to transform lives in Africa. And somehow it's something that is quite lofty and quite ambitious, and maybe not so different from the vision that the proponents of the decolonizing global health movement could have. But that somehow it's nice to have that big vision and somehow figure out what does it mean in practice. And in practice could be less. You have objectives, you have missions and all this and that. These are things we do on a regular basis. But somehow that every single person that is part of your institution or that's part of your movement has to buy into that. That ultimately research is there for the benefit of society in ways that are transformative, and that the highest impact of research is not because a paper gets cited in a, I don't know which journal, whatever classification you want to use. That the highest impact of research is that actually there's some kind of transformation that happens as a result of that process. So that's our vision. And as I said, it's part of that system and processes that we put in place as a culture that rewards and recognizes not just research itself, but also evidence use and uptake. Next slide. Next slide, please. So how has our approach evolved over time? As I said, when APHRC was established, the intent was that African voices would be heard. But then for many years, voices being heard was that research was done and then research was published. And maybe 15 or 20 years ago, about 15 years ago, it was common to say your good work will speak for itself. So as long as you do research, you publish it, somehow it will find its way into the hands of whoever it is that wants to use that. But of course, we know that that's not the case. And if I'm trying to draw parallels to the global health, the decolonizing movement, it's the same thing, that your intent are not going to be absorbed by diffusion or whichever process that it happens. There has to be an intentional way of seeing how, if your intent is that evidence is going to be used, how do you translate that? What are the things that you need to do that will in the end result in some kind of action that at the end of the day can be transformative as our vision stipulates. So underlying everything that we do, we build capacity for our internal researchers, not just to do research, but to see how do they translate research into evidence, because research and evidence are two different things. And how does that evidence result into some kind of action? And as I said, it's two ways that within capacity strengthening, research is happening. As research is happening, people are being capacitated, but these are also intentional processes. And sometimes some of the challenges we face with the dynamics around global health and power is that there's an assumption that an interaction between global health, northern scientists and southern scientists will, by virtue of that interaction, result in some kind of capacitation. And that many times capacitation is one way that the southern researchers are going to learn from the northern researchers. There's almost never an expectation that actually the northern researchers are going to learn from the southern researchers. But somehow, as I said, our approach is that we have to move from assuming that our intents are going to be actualized without us being proactive about seeing how that actualization happens, whether through producing evidence. And evidence itself, if it's out there, it's not as if the people that need it are going to land on it or it's going to hit them, because there's an avalanche of evidence. That there have to be deliberate processes, and that people need to understand how evidence results into action and to be capacitated to actualize that. Next, please. So at the end of the day, if our aim is impact, and as I've said, impact for us is that lives are transformed, we have to constantly question ourselves for whom or for what is the research that we do. And maybe the parallels for the decolonization movement is for whom is decolonization? Who cares about decolonization? And if that is the case, that there are other people that should care or for whom it's intended, that then it can't be that we are sort of moving in different directions. That on one hand, there's a global movement that is trying to change the way the world looks at things. But then on the other hand, that's the people for whom this is intended are steering or rowing in a different direction. So we constantly question ourselves, for whom is the research? And that the research has to be relevant and timely. It has to be shared. It has to be used. And it has to be, there has to be some kind of tangible change that has resulted from that research. And so that begs into question how we challenge the metrics for which impact is measured. And as I said, in terms of parallels, it's the same thing, that the decolonization movement has to question what does success look like and find out whether it's actually possible to measure that success and work towards processes and systems that will actually end up in that, in what success looks like. Next, please. So one of the things that we've been able to do, and I think something which is quite important, is to challenge existing models of how, for instance, evidence uptake happens. And this is based on many years of trying different things and coming up and saying that some things are clearer to us. And on one hand, dissemination is a dominant thing. If you look at everybody, when you look at pathways to impact, always says dissemination, dissemination, dissemination. But what we've said is that actually, if you're interested in evidence uptake, it's not that people want evidence that is served on a platter and they have to partake of that. People want experts. People want people that they can consult on a constant basis, whether there's evidence or not. And so we've moved from peddling evidence to saying we want to form long-term partnerships and relationships through which we learn from each other, we co-design, we co-implement, And through that, that's where we gain relevance and responsiveness. And so we don't produce evidence because there's some kind of metric and there's some kind of target that we're hitting with regards to the impact factors and whatever it is that you want. We're producing evidence because somebody wants it. But sometimes what that person wants is that you are available on a phone call, and when they call you, you can actually respond to them and answer a question that they have. And you don't necessarily have to peddle a policy brief or whatever it is that has come out of your research. So the parallel to that is the same thing that I've said earlier, that as a global movement, we have to ask ourselves, who is it that we want to influence? Who is it that we want to change? And who are the people, who are the experts that are sitting at the table and having these conversations, so that you can understand what it means to be an African that is trying to be decolonized, whether they want to be colonized in the first place. What does it mean and what does it imply? So that those insights can actually be fed back into whatever process is being undertaken. Next slide. So I think it goes back to the point I mentioned earlier, and that I think the take home from that is that expertise is not born, it's made. And therefore, from our approach, as I said, we've moved away from saying that we need to peddle evidence. We've invested in developing expertise. And going back to the paradigms around the global health, the decolonization movement, many times it's because there are these power dynamics. Movement. Many times it's because there are these occur because of the differentials in expertise. But to grow, to decolonize, has to recognize that if there are disparities in power, that they have to be built and they have to be invested in. But at the same time, recognizing that sometimes expertise and be a metric for expertise in the global health market could be defined differently, because our experts could have expertise, for instance, in how to talk to how to do a media interview, or they could have other expertise that is not measured in what we know or what we accept as metrics for expertise. Next, please. Defined differently because, for instance, in how to talk to. Next. So, how do we define impact? I think previous slide, please. How do we define impact? As an institution, we've decided that impact has different forms, and some of those forms, if the previous slide would project, is that it's, for instance, how doing research for many years and how evidence for many years in the end results in something that is tangible, and it's, for instance, transformative. The slide that I'm not able to see, I'm not sure whether everyone can see it, is a collection of media stories about our team and their involvement in launching the first human milk bank in Kenya, which is a result of many, many years on breastfeeding. And as an institution, if you're able to find the metrics that actually recognize this as success, as opposed to other knowledge metrics about how many people our team and first human milk bank in Kenya, which then that actually ensure, and as an institution, the metrics that actually recognize, and in a way, as I've said, being relevant to the local realities of what our decision makers and what our technocrats need. In the end, we are doing things that are relevant and that are topical and that are important to address the challenges that face the continent. And so while we didn't set out to do that, we may have unintentionally chipped the sand, and perhaps we're on the pathways to making, chipped the rock and we're on some pathways to make some sand. Next, please. Yeah, you can skip that. So what has worked? Some principles that are shared and known. I remember when I joined the institution where I am right now, it was made clear to us that there's partnership and then there's something else. So you have to know what is a partnership, what is a beneficial partnership, what is a respectful partnership. And once these principles are known and shared, then challenging the power dynamics that exist is not difficult. It may be it may be difficult, but then at least you know where you're starting from. Some of these principles that define what is truly a partnership. The other thing that has worked is capacity strengthening, our capacity strengthening ethos. Internally, as I've said, our aim is to develop experts and change agents, not publishing machines that churn out different papers. experts that are able to engage with society, they're able to engage with people that actually need evidence. But externally, as we do our engagement with other partners, that we have to invest in long-term sustainable approaches, but being cognizant of mutuality. We've been chastised several times when we went out there to build capacity, and we're challenged about why do we think that we're building capacity? Why do we think we cannot learn from the people with whom we want to capacitate? And I think going back to the parallels, I think that's part of the thing. I think I've had questions about, is this neocolonialism in a way? Is this movement a neocolonial movement where the power structures are not changed? The unidirectional, flow of expertise and knowledge has not changed. That somehow it is somebody in the South, in the North, that has to decolonize somebody in the South. That somehow capacity is about mutuality, that knowledge is not a preserve of individuals, that there are different types of knowledge. And actually, when you set out to build capacity, you have to be ready for your own capacity to be strengthened. That you have to have strategies, and you have to have systems and processes, rewards and recognition that go perhaps against the grain with regards to what is important with regards to scientific production, but also investment in long-term relationship with a broad set of actors that are outside research. And going back to the movement, that there's need to invest in these relationships with African institutions, with Asian institutions, with other institutions all over the world, so that it's not a unidirectional flow of expertise and knowledge and good intentions, that somehow there has to be some kind of mutuality in these relationships that will in the end benefit everyone. Next, please. So are there parallels to draw with the decolonization movement? Yes, I would say that the movement needs a vision and they need to work towards it, and that change doesn't happen because you want it to. That we need to recognize, acknowledge, and address power structures in global health, including our own power as individuals, but also our own power by virtue of our geography, by virtue of the institutions with which we represent. That we have to practice what we preach. If you want something to happen, it will not happen without systems and structures, and perhaps different metrics that measure how things are going to be done. And that you need to recognize your stakeholders and other actors, their capacity, their strength, and to be cognizant that no one has a monopoly over knowledge. And that the types of knowledge that we have, the types of knowledge that are contextual, they are just as important as those other types of knowledge that can be measured and put into nice packages with regards to the kinds of metrics that exist currently. Next slide, please. So going back to my key messages, that the decolonizing global health movement needs to broaden its reach, both geographical and with the kinds of actors they bring on board, and that the movement should have long-term objectives and work towards them. And that constantly chipping away is how rocks become sand, as I've said, whether it's by intent, whether it's by design, whether it's by accident, and that we hope that sand in the end is a good thing. I think I'll stop there. Thank you.